And neurosurgeons do well to cure 1 in every 1,000 brain cancer patients now. 1 in 1,000. Not too good results for me, but here's the one patient he loves that. They operate on. Radiation therapy slows the growth of adult tumors, gaining perhaps 1 month of life, and may result in a cure of only 500 to 1,000. 500 1,000 patients. Similarly, chemotherapy, despite 30 years of clinical trials, has not resulted in the development of a single drug or drug combination that elicits more than an occasional transient response in brain tumors. This came from an oncologist professor at the University of Washington Medical School. It's everywhere. When you start plugging in, unless you can get away from the people who are done with the money stuff and done with the money, because I have patients who work where? At oncologists, and they tell you that my oncologist would never do chemotherapy. Very rarely would they do this, and they don't want me to do it either. That's what they said. We have patients here who's from there. And so, chemotherapy. A recent study, however, claimed that the overall contribution of chemotherapy to a 5-year survival in adult malignancies was 2.3%. Chemotherapy now is rated, and this came out of Clinical Oncology, 2004. Clinical Oncology, good magazine or journal? It's cancer. This came from cancer researchers saying chemotherapy and radiation has a 2% success rate now. 2%. So how could it have saved you? You had to change something. You changed your environment in your body somehow. 2% success rate. How much money is it going to cost you? $80, $90, $100,000 is going to go to them, and they have a 2% success rate. This came out of Clinical Oncology. This isn't my studies. You can go, I would just plug it in on the internet. You will never see any studies, especially if you go to other countries, because they don't do this kind of stuff. They're very rarely, they don't do this. They have the studies done. You can't do that. Now we have a lot of American doctors who are finally saying no more of this. It's impossible. We haven't changed. No, our cancer hasn't changed at all. We need to change our lives. Dangers of mammograms. Sorry, we're going to get into this. Studies done on the benefits of mammograms. This came out of the Lancet. Does anyone here know what the Lancet is? A medical what? It's a medical journal. Another top one, October 2006, that mammograms do more harm than good because they expose the patients to radiation and increase the women's risk of cancer.
We've known this for 10 years.
How long? She did mammograms. She did mammograms, and you knew this?
And the funding was there, and they said, well, we have all this new funding, we're not changing our protocol.
So they said, we know it causes cancers and more cancers, and she said, they said where she works doing mammograms, that they knew it, they kept doing it.
They have way too much money invested in it, and they
Millions
weren't
and
going to change
millions.
their protocol.
Billions of dollars. Now you're talking to somebody who's right there. So
They bought 800 new machines.
800 new machines. Why would you stop doing it?
Tax dollars paid for it.
Yeah. We're paying for this. So that's how we're going to show you. Latest evidence shifts the balance toward harm and away from benefits. This came out of University College London. According to the Canadian columnist Dr. W. Gifford Jones, women between the ages of 40 and 49 with regular mammograms are twice as likely to die from breast cancer. Twice as likely to die from breast cancer than those who are not screened. Sources that create acidity. The reason why we talk about mammograms, it creates an acid environment. Mammograms is obviously not as much acid as a radiation environment in the body. But sources that create acidity. Meats. Meat. We have to stop eating conventionally raised meats. Meats are full of what? Hormones, drugs, antibiotics. Full of it. You can't eat meat. Meat is full of that. You have to eat what kind of meat? Grass-fed red meat and organic chickens and turkeys that are fed right, that have no drugs in them. Because what all the animals are pumped up with what? Hormones, and what are you eating? Hormones, and what do you get? Cancer. You get cancer from all that. You've got to stop immediately with your meats. Sugar. And packaged meats are just as bad or worse. Do not. Everybody thinks, that going to a restaurant that has all these packaged meats instead of going to McDonald's is healthier. Who the hell has ever worked at a deli before? What's around all that meat? There's a slime in it. It's nitrates. It's very, very dangerous stuff. It's not even real. The stuff's not real. I know, we're stopping here, but no. But it's not real. You've got to eat real meat. What you do is, my wife, if you want to cook your meat, fine, we cook ours. She'll buy a big organic chicken or turkey, and we can eat that for the week and make sandwiches out of it or something. We'll make a lot, and then we can eat it later on. And so if you want, well, it's easy, it's quick. You know what? When 20 years from now, when you or your child has cancer, or if I have to dig when I'm in there digging my child's grave, which will never happen, whose fault is it going to be? It's going to be mine, and I take full responsibility of that. Once he's over 18, he can do whatever he wants. But until my child's 18, I'm responsible for learning everything there is and making sure he doesn't do that. making sure no matter what happens that my child is living a life to never have these diseases ever. Sugar, refined carbohydrates. Sugar is acid. It destroys the immune system. Grains turn to sugar in 4 seconds. Grains. Well, what about whole grains? We're not saying totally get rid of all of that. Or if we do eat some grains, if you have cancer at all, you can't even have a grain. For at least 6 months to a year, you can't touch a grain or a sugar or a fruit or anything. But those of you who know you're pretty much in a healthy state, most of you don't know that, but then you could probably possibly have a little bit of the grains. A little bit. But our goal is to eat our carbs from vegetables. Dairy creates acidity. Caffeine, salt, alcohol, tobacco, artificial sweeteners, and all medications create severe acidity. Every time you take a drug, you create an acid environment. Drugs are what? They're dangerous, dangerous chemicals. If you swallow a whole bottle, what happens? You die. If you swallow one pill, how does it kill you? It kills you slowly on a cellular level. It goes through your bloodstream and begins to kill your body. Proper pH, alkalinity, acidity. Yeast, fungus, molds, bacteria, and cancer can only thrive and only live in an acid environment. They thrive in acidity. Yeast. If you have a yeast infection at all, how do you know that? We're going to have you tonight, those of you who want to check, because you need to get rid of your yeast infection immediately. You're going to, you spit in a glass. You spit in a glass of clean water. You spit in a glass of clean water, you leave it up on your refrigerator somewhere, and you start watching it. If there's little strings coming off of it, you have a yeast infection. And when you have a yeast infection, it creates an environment for cancer to thrive and fast. You have to get rid of it. The body's fermenting. It's a sugar environment. It's acidic. You have to get rid of yeast immediately. So you spit in a cup, and you'll see these little strings coming off there, and little legs coming off there. You have a yeast infection. Then you come back in, and we'll teach you naturally how to get out of that state. So you have to do that. We talk about the detoxification process we're going to get into in a second here. But a lot of you have heavy metal detox or heavy metal toxicities. You have to get rid of those immediately. How do you know when you have a heavy metal toxicity? How do you know? You have to do testing. That's the other type, all the protocols we're going to get into that we do. You have to be tested for those. You can't keep going on. Mold infections. Almost 80% of this room, probably 70%, has a mold infection. If you have a mold infection, what's your immune system attack all the time? The mold that can't fight cancer. A lot of cancer patients have mold infections that are secondary as well. You have to get rid of that mold immediately. And we're going to go through that. Dr. Susie's going to be having appointments for that. Yeast, fungus, and molds live in that environment. Nerve impulse. Obviously, we're going to get into this nerve impulse. You guys have to really understand on a cellular level what's happening when you get this adjustment, when you get this life-changing thing. That God put all of our power where? In our brain. Our brain knows exactly what to do, and it knows how to. The most important thing the brain does, most of you don't know, it detoxes you. It cleanses you. It cleans you. It creates digestion and absorption. Every time you put food into your body, the brain's job is to do what to it? It's to look at it and go, do I need to flush it out of you, or do I need to keep it in you? If your brain and body aren't connected at 100%, every single day of your life, no matter what you do or eat, even if it's good stuff, it can't be absorbed. It would be impossible. The brain-body connection is the key connection in almost every single cancer case. We haven't seen it any other way. All cancers, in almost all diseases now. Because they know one person eats terrible and lives to 90 and smokes, and one person doesn't do anything wrong, and at 3, 4 years old, they already have cancer. It's because they have a disconnection between brain to body. Brain runs and controls everything. It's the #1 key to fighting all diseases in the body. Because a lot of you here came in with diseases and came in with things, never changed anything except for your brain-body connection, and you began to heal from everything. So how do we find that? Obviously, we check the central nerve system. The brain controls all organs. Health is when your brain and body are connected at what percent? 100%. It's the #1 connection in the body. #1. How do we find that? Most of you know we first find that through computer technology. Computer technology. That we know now through those computers. That's why if you guys are missing your re-exams or we got behind, pull us aside. You have to have a re-exam. Because the re-exams and the computers, the exams are showing us, is there a blocked nerve? Is there heat in an area? If there's heat in an area, the nerve is blocked. If the nerve is blocked, what's going to happen to that organ? It becomes weak, it starts to form cancer faster. If the brain can't talk to an organ, that organ gets cancer. If this nerve right here is blocked to the lungs get cancer faster. If this nerve is blocked to the colon, you get colon cancer faster. The nerve supply has to be there at 100%